Hello everyone. This is the second video on the topic of insomnia and how to overcome it. In this video, we will continue to talk about a multifaceted approach, a series of things that we can do to improve our sleep. So just in case you didn't have a chance to watch the first video, it is linked down below. In this video, we are going to discuss electronic devices, a bedtime routine, and we will also discuss how to help our brain let go of the day and to calm down so that we actually might be able to fall asleep. So let us talk a little bit about electronic devices. You probably have heard before that it is advisable to not use electronic devices about 2 hours before going to bed. And the reason for this is that the bright light in our electronic devices, when it is absorbed by our eyes, it reduces the production of melatonin, which is a sleep hormone. So melatonin, our body starts producing melatonin to signal to the rest of our body that it's time to sleep, and it helps us to feel sleepy. So if we engage with electronic devices, the bright light, especially the blue light from these devices, can affect the production of melatonin in our body. If we engage with a brightly lit electronic device for 1.5 hours, then our body stops producing melatonin. So this is why there is this advice that 2 hours before going to bed, it is good to stop engaging with electronic devices. If there is absolutely no way and you just have to use an electronic device for whatever reason, you have a deadline coming up, then you might consider finding a blue light filter app online. So for example, I use a filter that is called f.lux, f.lux. If you just Google it, you'll find it. When I downloaded this app, it was free. I didn't check if it is still free. So, and this is not this is not an advertisement, and I have not partnered with this app. I'm just sharing with you what I use on my own computer, and I have it installed on my own laptop, and also on my phone. So that might help. If you have that app installed on your computer, then the closer it is to your bedtime, and you can actually tell the application when is your bedtime. The app will make sure that the coloring of the images on your screen are more yellowish rather than bluish. So it will reduce the amount of blue light that's coming out of your screen, and that might help. That being said, it's better to avoid using electronic devices altogether 2 hours before bed for the following reason: because it's not just the light in the electronic device, it is also the stimulation. So there is research that shows that both passive and active participation with electronic devices. So passive participation would be just watching a movie, or an active participation would be something that that requires your input, like playing a game. Both of those types of engagement with electronic devices can significantly interfere with our sleep. So even if you have a blue light filter installed on your electronic device, even if it's passive participation, some devices actually even have like a dark screen mode. So it's like the application that you're engaging with would be on a black background. So even if you are pulling all of these stops, it is still your sleep is gonna still get disrupted just by the mere fact that you are engaging with an electronic device, that basically your brain is being stimulated by some new information that it still needs to process before you can actually fall asleep. So I have to say that this recommendation is easily said than done. And in order to be more successful with putting away electronic devices before we go to bed for 2 hours, it's good to have a bedtime routine. So it's good to have, I even sometimes I would have this, I don't wear that anymore, but I had this kind of Mi Fit device. It was like a little watch, electronic watch that would kind of give me a signal 2 hours before I go to bed, that it's time to actually start my bedtime routine. And so your bedtime routine can be brushing your teeth, maybe taking a shower, putting on pajamas, whatever it is you decide that might be helpful for you to kind of wind down, maybe reading a book, anything that might help you. So if you're serious about improving your sleep, and if you want to try to stay away from electronic devices, then maybe this tip might be useful for you as a bedtime routine. It's actually very helpful. And it goes into the cognitive component of the cognitive behavioral therapy for insomnia, right? Because putting away electronic devices, that's a behavioral change. We change how we act around our bedtime, and to change how we think around our bedtime, what we can do before going to bed during this 2 hours as we wind down to bed, we can journal a little bit. And so you can journal if in any way that's helpful to you, of course. There is a particular prompt for journaling that I would like to share with you that you might like. So you may just want to write good things that happened today, and write down good things that happened during the day, bad things that happened today, and write down the bad things. No judgment, just write them down. And things I need to do, and then just write down the things that you need to do and when you plan to do them. So this exercise actually helps to our brain to kind of put away the worries from the day. So we sort of come to terms, like these are the good things that happened today, and you may even throw in some gratitude in there. I'm grateful for all of these things. Actually, practicing gratitude is actually very good for our health. And then bad things that happened today. So it's just writing them down and just again letting them go. No need to ruminate over them or to beat yourself up, and sometimes those may be things that we just didn't like. Just acknowledging them, just giving our brain a chance, giving our mind a chance to kind of put it aside and let it go, so that we can go to sleep and we don't think about those things. And while writing down what I need to do, it doesn't have to be like a very precise to-do list. Like if you like doing to-do lists, that's great. You can do them at that time, or you can do them at some other time during your day. The purpose of this writing down what I need to do is not so much to create a to-do list, but to allow our mind to let go of the things that we think we need to do, so that we do not think about them when we are trying to fall asleep. So by just writing down things I need to do and when I'm going to do them, we are kind of giving signal to our mind, and we are helping our brain to kind of calm down and realize that, well, okay, now it's time to sleep, and whatever it is that I need to do, I already wrote it down, and I'm going to do it whenever it is that I wrote down in my diary. So this is a cognitive component that may help with falling asleep. So here you have, for the next week, if you want to practice, if you want to continue working on improving your sleep, you have these basically two major tasks that you may want to accomplish, and it's completely up to you if you want to do that or not. But if you really want to improve your sleep, just listening to this video is not going to do this. It's actually what you do is going to make a difference. So the first task is to put away electronic devices 2 hours before your bedtime. And then for the 2 hours before the bedtime, engage in a bedtime routine that might include journaling, good things, bad things, and things I need to do. And the second thing that you that was the second thing that you, sorry. So the second thing was the journaling, good things, bad things, and the things that you need to do. So one more time, put away electronic devices 2 hours before bed. And the second thing, have a bedtime routine and write down good things that happened today, bad things that happened today, and things you need to do. Be patient with yourself and congratulate yourself if you've been working on improving your sleep last week, following the advice that I provided in the previous video. Congratulations to you. It means that you're serious about improving your sleep, and it does take time. So just be patient with yourself. There are more things forthcoming that you need to do. I'm not sharing them with you all at once just because I myself probably would not be able to implement all of those changes simultaneously. So if you like this video, please give it thumbs up. Please subscribe to my channel, and I hope to connect with you soon.